We want to prolong life, but we don't want to prolong the dying process. It is as people get closer to death, it becomes much more complicated and intense, both in terms of their medical needs and the need for complex decision making. My name is Vijay Periyakoil, and I am the Director of Palliative Care Education and Training here at Stanford University School of Medicine. I also direct the Stanford Hospice and Palliative Medicine Fellowship Program. I trained in a county system where my oldest patients were in their 50s, and I found that at the end of training that I did not know much about taking care of older adults. And so I sought additional training in geriatrics to continue to keep my patients. And then as I started going into geriatric training, some of my patients started dying. And I found that suddenly I didn't know anything about taking care of the dying people. And that is why I went into palliative medicine. Palliative care is something that promotes patient comfort and dignity. And what we hope to do, or what we aim to do, is match patients' values in terms of what they want done for their care with the kind of treatments we should be offering them. People who don't truly understand what palliative care stands for worry that we are there to come and stop all curative interventions and just make people comfortable. In reality, I would argue that palliative care is all about getting people to live longer and feel better. Why do we need to train young doctors in this? We have about 2.2 million Americans who die every year. Then you probably have like 20 million people with chronic illness and roughly about 5,000 palliative care subspecialists. So absolutely, we need to have more balanced availability and access to palliative care across the board. Ours is a 12-month clinical fellowship for internists and family medicine physicians, where we talk about very basic biomedical principles and how to communicate effectively with patients and help to get them to a point where you take something that's really awful that's happening to them and help them process that so that it's a bit more manageable. And that, I would say, is the part about my job that I really love to do, to train fellows in integrating the highest level of technology and biomedicine with the most humanistic component of medicine, which is about being present at the bedside and healing and supporting patients and families. Caring for patients with advanced illness and giving bad news day in and day out can be pretty stressful. But I think for me personally, it is just wonderful to be a part of this new field, because all of us are very passionate about a common goal of advancing palliative care in this country. An emergency medicine resident came to me today and said, I see a lot of patients in the ER who are in pain. I really want to specialize in palliative care. How should I go about doing that? That question made my day. That's all it takes. Someone who's young and passionate and interested, who wants to go into this field and build it for their entire lifetime. That's good enough for me.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.